So everything almost that could be safe isn't safe. Yeah, and it's almost like this mind game. Like the doctors, the policemen, the like what is it, all the people in Mr. Rogers' neighborhood, are they still safe? I don't know.
Welcome to Counselor Off the Clock. I'm Lydia Thompson, and I am the host of this podcast and a licensed counselor. On this episode, we're exploring a topic many of us experience: the mental and emotional challenges of food allergies. Are you one of the millions navigating the world with food allergies, or maybe you just love someone who is? Then you know it's much more than just avoiding certain foods. It's navigating relationships, managing anxiety, reevaluating your identity in a world that doesn't always understand. If you don't have food allergies, this is a great episode to learn how to advocate and understand those who do. To help us understand this better, I'm excited to have Heather Hargis with us today. Heather's a licensed therapist who brings her own experiences and deep understanding of Maslow's hierarchy of needs to help us see the far-reaching impact of food allergies. My aim is to make mental health conversations more accessible and to keep you company while you grow. If you are loving this podcast, subscribe, give us a rating. I hope you can get comfortable because we are off the clock. Well, welcome, Heather.
Hi.
To the podcast. As you know, I'm feeling a little bit under the weather, or recovering from being under the weather. Yeah. So, for all of our listeners, I'm okay, but I just sound like this today. That's okay.
It's because we're talking about allergies.
We're talking about You're bringing it all together, aren't you? Well, apparently Heather and I have known each other for like a long, long time, or at least our worlds have been parallel with one another since I was a child.
Yes.
However, we know each other mostly from a professional setting, because you and I are both counselors. We worked in the same office,
right? Yeah.
For a while, had one supervision together. Yeah, but apart from that, I heard you speak at a therapist meetup about the topic we're going to talk about today, food allergies, and I was so fascinated. I was like, I have to have you on the podcast. So here we are. Yay, we're doing it today. Amazing. Well, welcome. I want to start off with, why is this topic of food allergies important to you?
So a lot of it's based on my personal story, and not a story of having food allergies since I was a child. My journey was a little different, but in 2018, I woke up in the middle of the night, hives, or the beginning of hives, and I was like, I've never had this before. What's going on? Looked for Benadryl, didn't have any because I've never needed it before.
Yep.
And so I ended up driving, hives all over my body. Drove myself to the Vanderbilt ER. And woke up at 2 a.m, was there by like 2:40, and they just took me right in. And it took me another 6 months to get diagnosed with something called alpha-gal syndrome, which is becoming more well known, sort of unfortunately, because more people are getting it. But it's a tick-borne food allergy. So a lot of people who have heard of it would say it's a red meat allergy. You can't have any red meat, which is true. But it's really all mammal products can cause a reaction. So that could be dairy. You don't know what's in medications. You have to look at magnesium stearate. Where did it come from? How was it sourced? Like all these different things. And so I joined, it was 2019 when I was diagnosed. So I was heading we were heading into the pandemic. So I joined all these Facebook groups. Like, I want to know more about this. I did have one other friend who had been diagnosed at the time. And started hearing these stories that made me realize that my severity, though definitely complicated, my life was not as difficult as some people. Some people are allergic to fumes. So they could not necessarily, on like the 4th of July, when they're grilling ribs outside of a Kroger,
I was about to say,
that could cause anaphylaxis or some sort of thing. So, but I started hearing these stories, and I was like, there's got to be something, or some way to work with food allergy anxiety. So I did a online course to be a certified food allergy mental health coach or something. It was like a bunch of words. And learned a lot about, the difference between food allergies. Is it intolerance? Is it a sensitivity? Which all of those are different. How it affects families and individuals over the course of a lifespan. So working with like a 3-year-old who has a food allergy is a lot more about managing parents' anxiety.
Right.
But then if you get to like the 16-year-old who's going to prom,
right,
and the dresses they're wearing to homecoming and prom now, they're pretty fitted. So where do you carry your EpiPen?
Yep.
Yep.
That's a great question. So you just started going after you were diagnosed. Your curiosity kind of took over of how is this affecting other people? And even larger, how does food allergies affect the greater population?
Yeah, absolutely.
So I love that about our profession too, that our curiosity sometimes just takes over and we've got to know how this affects other people.
Right.
Tell me about what it was like for you to adjust your life to this food allergy, this tick-borne food allergy that you had never had before.
Right.
What was that experience like for you?
Confusing, I guess, would be the short answer. So I tend to, and this is part of the training I did, look at food allergies within Maslow's hierarchy of needs. So there's so many different levels of need that are, I guess, called into question. Is food safe? Is air safe if you're, allergic to fumes, whether it's peanuts or alpha-gal? I think the hardest thing for me was probably, because I've been fortunate within the medical community, not everybody is, but people working with me, but was the love and belonging. Like someone can't say really quickly, hey, do you want to go meet for dinner? I'm like, well, where are you going to go? Let me look at the menu. Do I trust them? Do I need to call ahead and make sure that there's no cross-contamination? Do I, if we are going on a trip, I have a girls group, we go on a beach trip every year. And if we go somewhere new or different, there's not a lot of flexibility. Well, there is flexibility if I choose to be anxious about what I'm about to eat, right? And so that's where there's a cross between if I want to be with people or if I want to be safe, and that conflict creates the anxiety, which is true for me, but also for anybody else really who's having to make that choice.
I hear more anxiety, more forethought, more planning, and then it affecting your relationships. Yeah. So how did your friends and family react to you developing this allergy?
It mostly, again, I've been fortunate. My family has been very accommodating. I know and have worked with some people whose family doesn't believe that it's a real thing. So if you're going to go over for Christmas dinner, they may still be making what things you can eat. With friends, mostly it has been fairly easy. I've had a few people make some comments that I found insensitive. Like, I would rather die than not be able to have a hamburger. And I'm like, oh, really? Because I could. Right? But
and people make those comments in jest, and that can be really hurtful to make a comment like that.
Right. And some of it is my own, and I feel like a lot of this is probably true, for at least for a lot of the people that I've talked to. I never want to be that girl who is being high maintenance or having, I'm like, no, I'll find something to eat. I'll just eat lettuce, But that's part of my journey of self-advocacy, being able to advocate for myself and what I need.
Yeah. There are people that go out of their way, I'm sure, to adjust, to make you feel cared for. I know my husband and I have several vegan friends, and that's really important to us, that they have an option to eat. Or else, one of my friends will be like, it's fine, I'll just, eat lettuce. Like, I'll just eat the toppings of the burger. I'm like, no, we're going to have you a veggie burger. Like, it's going to be fine.
Right.
I want to care for you in that way. However, red meat and, I mean, allergens as a whole,
Right.
for some people, are everywhere.
Right.
And so it affects anywhere they go. Yeah. So you see clients with food allergies. Yeah.
Right.
How do people find you? How do they know they need to see a counselor about their food allergies?
Right. So I am involved kind of in this Alpha Gal network, and I have some friends that have referred people to me. I guess sort of word of mouth. I think probably a couple of people have been referred from, I don't know for sure, from their allergist, who I'm assuming is my allergist, but I don't know that for a fact.
Yeah.
But I have connected with some of the providers at his office, so I would say that too.
Yeah. So how would somebody who has a food allergy know that they might need additional services to support them?
Yeah, so I'm actually in a PhD program right now, and I'm doing my dissertation on, the lived experiences of people with alpha-gal syndrome and how it has affected their mental health. And one of my goals for that study, once I finish it and hopefully, knock on wood, gets published somewhere,
Yeah.
is for there to be some sort of baseline for medical providers to assess for whether or not someone who has been diagnosed with a food allergy could benefit from mental health treatment. So that's a goal. I would say if it is something that is affecting your life, almost like any other event that happens in your life, it's affecting your life to an extent that is severely lowering the quality of life. Because on some level, it is would be expected with a food allergy that there's going to be some sort of discomfort in your life and having to stand up for yourself, or whatever it may look like. And some people are able to manage that, whether it's because of their community being more respectful, whether it's because gluten-free is really easy to find right now, and plant-based actually is pretty easy to find. But then I think that there are some people that, using alpha-gal as an example, who live, 2 hours from the closest Whole Food or Trader Joe's, and how do you find things at Walmart? Or how do you... I've also found that identity can be an issue. Who am I if I'm not the person who hunts his own meat and eats it?
Yeah.
Who am I if am I the weird kid at school that has to ask the guy that I'm kind of dating, has he had peanuts in the last 24 hours before we have our first kiss?
Wow.
Like
that adds like a level of complication
right.
and like relational awkwardness sometimes. I want to actually start with how a lot of people have food allergies, which they're born with.
Right.
And so what you were sharing, maybe I'll jump ahead, right? From what I remember from your presentation, that a lot of times the first disruption is kindergarten. Can you talk about what happens when a child has a food allergy and now needs to go and spend time outside of their family system?
Right. And I would say in that case, the biggest adjustment is really for the parents. To trust.
Say more about that.
Yeah, to trust not only their child, but to trust the system that they're putting their child into. And it's gotten so much better with, I think there's 9 food allergies that have to be listed. And I remember when my niece and nephew were going to school, okay, well, you can't have it. My nephew lived in Philadelphia, and he's like, I want to bring biscuits because he's has Southern family.
Yeah.
Nope, no gluten, no peanut butter, no dairy, no, so there's so many things that are better there. But there's ways to even teach the kindergartner, for example, if these are the things that you may feel. If your lips feel tingly, if your stomach hurts, if helping the child to identify what those feelings might be physiologically.
Yeah.
Then what do? Who are the safe people? Go to an adult, go to this teacher, go to the office, so they know what they need to do to take care of themselves. Definitely being on the team with the teacher. And it was interesting, one of the things I talked about in the training I did was the idea of, especially around that age, in our family, we do this. So you may go to your friend's house and they may not wash their hands before and after dinner. But in our house, we do. So it's okay if you do that. Also teaching them to use their voice to say, I'm allergic to nuts. and that's okay, just to say that. And so people will pay attention to that, so you can advocate for yourself. Teaching advocacy for children on so many levels is important, but definitely with food allergies, which can lead to anaphylaxis. And that's where the line is drawn with an allergy, is that it can lead to anaphylaxis more so than just discomfort.
Yeah, it's not a tummy ache. It's, can be life-threatening.
And it's interesting, anaphylaxis is actually when two body systems react. So it could be your digestive system and hives. It doesn't necessarily mean that your throat's swelling, although that is often what happens. But any two body systems that are reacting to something would be considered anaphylaxis, which was new info to me. I thought it was just, my tongue swelling, that's anaphylaxis. So, but teaching the children to know what to watch for, to know where to go, to know what is safe. And this is true for almost any anxiety, I believe, but the idea of uncertainty. And I would say with food allergies, there's the uncertainty along with sometimes a lack of or an absence of control if you're not preparing something at home.
Yeah. So I can imagine a kid who, we're striving to have kids just be kids.
Right.
And we have to teach those kids to be on the lookout.
Right.
Be vigilant. But also be a kid. Just,
Right.
Just have fun with your friends. But also be on the lookout. And also, be uncertain. Don't just put something in your mouth.
Right.
Without reading the ingredients. Without asking an adult.
Right. Absolutely. And it's a difficult line for parents to instill the importance and the gravity of following these certain rules, while at the same time not teaching their children to be afraid of food or to be afraid of new food. And it's interesting, like some children are just by nature more bent to be less risk takers, so not want to try any food, than those who are more risk takers. And so it really depends on your child too.
Yeah, absolutely. So I can imagine that food allergies can create anxiety, OCD.
Right.
It can create an aversion to food, like ARFID.
Right.
So all of this bodily function can also create psychological issues.
Right.
Yeah.
Absolutely.
And that would also be a time that they would probably seek counseling services.
Right, absolutely. And it's interesting too, and this kind of goes with the age and stage of a child. Like if you're looking at someone going to college, they probably would be more likely to give up the connection with others and stay in and eat safe food, so they're more lonely. But I'm saying that's usually what happens. I hate to make generalizations just like that, but if you have a child with a food allergy, are the grandparents on board? So there's lots of unknowns that can click up anxiety for children, adults, parents, maybe even grandparents, if you're worried about having your granddaughter come stay a week with you and she has food allergies.
Well, let's start actually from the beginning.
Mm-hmm.
I actually would love to hear, I mean, for some people listening,
Yeah.
they don't even have a concept for what Maslow's hierarchy of
Okay.
needs is.
Yeah.
So can you educate us a little bit about Maslow's hierarchy of needs? It's starting off with the physiological needs. I think that one seems obvious to me, but can you go through each stage?
Yeah.
Or stage?
Mm-hmm.
Each
That works.
level? Whatever.
Higher level of the hierarchy.
Yeah.
We'll call it a stage. It's fine.
It's fine. Call it whatever.
Yeah.
Can you go through each one to kind of outline how a food allergy affects each need?
Mm-hmm. For sure. So yeah, the physiological is fairly straightforward because we have to have food in order to survive.
Right.
Or water. And some of that comes into play when you have to choose between some of the different needs. So if you're choosing food over love and belonging, or if you're stuck and having to choose that, there's an image I keep referencing where there's the desire and then the two needs are in conflict. And that's where the anxiety comes in, or the fear.
Yeah. So baseline, we have to have food to survive.
Have to have water, have to have shelter, and the nuances of, I mean, food, straightforward, yes. But if you are even, so this isn't just with alpha-gal, it's also with peanut allergies. Sometimes the fume reaction can affect breathing, even if you're not eating.
Yeah.
There are some people that I have encountered who, with the mammal allergy, would be allergic to wool. So even clothing, you have to be careful with where, it's coming from. And I assume that there are probably other kind of nuanced pieces of that too that would be relevant for other food allergies. The next one, the safety. And I think this one, it's interesting because it can kind of correlate with teaching, especially children, this idea of advocacy. I remember being about 9 or 10 years old and with no food allergies and going to a restaurant with my parents, and they're like, "Hey, you're old enough to order for yourself now," and I'm like, "Oh
my
no, I don't want to do that. I don't want to do that." And that was a big deal for me, And so the server would ask, "What do you want? What do you want?" And look at me, and I'm like, "Well, I'd like some shrimp scampi, please," or whatever it was. We probably at Red Lobster.
Yeah.
But teaching your children to be able to order for themselves and state those needs is important, and that is part of the safety level. Anytime you eat at a fast food restaurant, or any restaurant really, there's a level of uncertainty. And this is true for people without food allergies, like how long have they left the milk out? There's a lot of things that we walk into with uncertainty. But for children and for adults alike, knowing the places that are generally safe is difficult, whether it's, again, if you're unconscious for some reason, whether it's food allergy related or not, having someone who can advocate for you at the hospital. Is the hospital safe? So this is a friend of mine has alpha-gal and is allergic to fumes, and has to ask if she's in the hospital for her not to be put near the kitchen. Or other people's, like, these
this
little
is something like
things,
I just never would have even thought about.
Me either.
And I think that's the privilege that I have with not having a food allergy.
Right.
Is that I don't have to think about these things.
Right.
Yeah.
Right. Yeah. And because this is in my dissertation proposal, so I'm not going to get these statistics exactly correct, but I believe like prior to 2018, there were like 30,000 people who they thought had alpha-gal. Now there's like 450,000, so the numbers are going up. But most doctors do not either know what it is, this is from a CDC study,
Yeah.
or are not comfortable treating it.
Wow.
So depending on your allergist, whether it's alpha-gal or, because there's lots of different ways people treat allergies now, there is an in-office challenge. Like if you have been going through the protocol of eating a little bit of peanut butter every day to sort of build up the tolerance, and you go into the doctor's office and you eat a peanut butter sandwich and you sit there and you see like I actually have not gone through this testing yet. It's been recommended at some point, and I'm like, but does your allergist know, and can you trust? You really have to be able to trust the medical professionals around that. So everything almost that could be safe, is it safe? Yeah, and it's almost like this mind game. Like the doctors, the policemen, the like what is it, Mr. All the people in Mr. Rogers' neighborhood, are they still safe? I don't know.
Yeah. And it seems like what keeps coming up is that questioning.
Yeah.
It's like, am I safe? Am I safe here? Am I safe there? If I go to this restaurant, am I safe here? Can I trust that when I say I have a food allergy, they're going to be treating it seriously and not having any cross-contamination?
Right.
Can I trust that? Can I be safe there?
Yeah. And what do I need to do to be safe if I don't know? Do I have to... I'll talk more in detail about this in a minute because I think it's important too. But do I carry wipes to wipe down the table at any place that I go into? Is the level of reactivity that strong? That's not something I've had to do or worry about so far. But, especially with like gluten or celiac disease, the little crumbs can be really difficult. And what I want to come back to is the idea of uncertainty and am I safe? Am I safe? Am I safe? The next level is the love and belonging. And I will say one technique that's kind of worked for me in that area, and it's something I suggest, is it's almost kind of akin to a mindfulness practice. Like if I'm invited to something, I check in with myself. Do I feel like going if I'm not going to eat anything? Will I feel deprived? Will I feel like I stick out? Or am I feeling confident enough today just not to care? Or is that person who made the comment about the hamburger going to be there, and do I feel like going in, it wasn't intentional. It wasn't intended to hurt me. I'm aware of that. But on that day, I probably, if I had gone through that process for myself and realized that was going to happen, I might not have gone. But with the love and belonging is having your core people and then checking in with yourself to make sure that you're going to feel emotionally safe, I guess. Not even whether it's physically safe where you go.
Yeah.
But a lot of some of the things that I would read on Facebook about people not feeling safe going to family Christmas events, or what if my friends that I go on this girls trip with were not people that were willing to do the things that I need to do within reason, then would I just not go? Or whenever they went out to eat, would I,
it sounds incredibly isolating, or it has the possibility of being incredibly isolating.
Right. It can be, absolutely. And especially, like, depending on, this might even be if you develop a poison ivy, it's not allergy. Let's use that for an example, too. It's not food allergy. And you're a hiker. And so all your friends are people that go hiking, and that may not be something that you can do anymore. So it can isolate you not only from events around food, but events in other settings that you might have participated in before. And I'm thinking right now of another person that I know that developed a peanut allergy as an adult.
Wow.
And I don't think one is harder than the other, because it's hard for a kid or a teenager to not fit in or to learn how to navigate the world with the knowledge that it's not always safe. Because as children, mostly we tend to think things are safe, if we're in a safe environment. And which then flipping to an adult who has established a life around food, friends, and then has to change too. So, the next one,
I guess I do want to pause on love and belonging,
Mm-hmm.
because I have a memory of the kids that have food allergies sitting at a table by themselves.
Right.
And I think it can start so early, even with that labeling. Like, I knew who in my class was the reason why we couldn't have fun things.
Right. Yeah.
Right? You're the reason why we can't have Reese's peanut butter. Right?
Right.
And so as a kid, I didn't really know, but I think it affects kids so early, or can affect them so early.
Right.
In affecting their belonging in the world, and how schools and how families and friends treat the food allergy, I think affects the amount of belonging that they have.
Well, and I can imagine, I'm seeing that same picture you had described of kids sitting at the table by themselves, and that it's your fault that we can't have whatever treat you want to have. I can see, I have not seen this personally or in my practice, but shame being attached to that. Like, my body doesn't respond the way everybody else's does to this food. I must be bad. My body must be bad. And really in the way that, we've grown so much in the way that we approach food allergies, thank goodness.
Yeah.
And, thinking about my niece and nephew who are almost 12 and 14, for them it's just like not a thing. So-and-so can't have dairy. Okay. Which I'm grateful for, but it depends on the setting that you're in.
Mm-hmm.
Right.
Yep, exactly.
I'm sure there's some socioeconomic stuff that goes on there too.
Yeah. Well, I think you're hitting on something important in that how your loved ones and how your community reacts can make this, I would say, traumatic to have a food allergy. Even without going into anaphylaxis, can be traumatic for a life. Or it could be just nothing.
Right.
It could just be like an adjustment. I mean, it affects your life, obviously, but I guess I don't want to say nothing, but it can be just an adjustment, but it's just something you go along with.
Right.
And I think this is why I think I wanted to put this out to a greater audience, was that we can be a part of making this easier for people.
Right.
That they don't have to doubt our care and love for them. And they can be welcomed anywhere. Right.
Absolutely. And it's as you were saying that, I was thinking how much of the things that happen in our lives that could be considered traumatic in some way are oftentimes made more manageable because of the community that we have.
Yeah.
And the support systems that are around us, whether that be professional or personal. And what you described could be the difference in why someone might need to make an appointment with a therapist to work through their anxiety or their shame or their, whatever it may be around food. And this isn't to say necessarily that it's because you don't have a great support system. Some things just hit harder at different points, but that can be a difference maker for sure.
It can definitely be a difference maker to have people that believe you and will advocate for you and care for you. I know I'm like summing this up, but I'm okay. But I really am huge on belonging and people feeling loved, and so it like breaks my heart. Right. That some people don't have that, where their friends will listen to them,
right,
and believe them, and make them feel included no matter what.
Absolutely. It's making me think, I wonder if love languages change with food allergies. Does acts of service suddenly become more important? I don't know,
Maybe.
but it could, yeah.
But I bet it goes a long way.
Mm-hmm.
In your experience.
Right.
Have your friends, I guess, in what ways have your friends shown you love and belonging with this diagnosis?
It's funny because I can speak to different ways, and I will, but sometimes too, the person with the food allergy has to do the work too, because at one point when I still watch for cross-contamination pretty closely, but my friends had a tray of, things they thought that I could eat at the party, which was true, but they had the vegetables and the sliced salami or whatever right next to each other. And I was like, but for me, I was like, okay,
Right.
I have to reframe this as they did something with me in mind, and I'll find a way I can eat the vegetables on this other side over here, not the stuff that's touching the meat, because I can't expect them to know every nuance, about what I'm comfortable with, is a way I would say it too, what I am comfortable with.
And they made an effort.
Yeah, absolutely.
Which goes a long way.
Right, absolutely. And being willing to, my family has been great with holidays. And, if there are going to be, if I go down to visit my sister, she lives in Atlanta now, I mean, they will probably have veggie burgers with some sort of vegan cheese, and the whole family will eat it, and it's good. And if the kids don't like it, then they can have a little something of their own. But thinking in advance for where when I'm going to be there. Also, friends that are comfortable with me picking the restaurant. Gotta be a little bit controlling sometimes.
It's called advocating.
It is. And to come up with, I may come up with 3 restaurants and say, these 3 look really good to me. This one I wasn't sure about, but I called and I feel like it's going to be okay.
Yeah.
And then let them choose out of those 3. That, and that's me doing a little bit of a heavier lift, but they're willing to let me do that. I'm trying to think of other times when it's not just about food. I have had friends, when I come over for something, they're like, okay, well, we are having chicken and this, and we're going to cook this in another pan. And I'm like, thank you for remembering that.
And I'm going to go ahead and let you know.
Yes, it's going to be,
It's
so
going to be done.
That is, not always having to be someone who is asking the questions is helpful too.
Yeah.
And my, I think even my parents and sister family have started looking into different recipes that are plant-based and or vegan, and making it fun. Like, oh, we really used to like to eat this certain thing on Christmas when we were kids. How can we recreate that?
Yeah.
So it's
I
creative.
think that's really cool, and I think important that it's not like, oh, Heather has her special thing over here, and we're just going to eat normally.
Right.
We're going to integrate Heather into, we're all going to eat differently.
Right.
I'm wondering how often you see that families do something like that, where the whole family adjusts, or, hey, here's your special turkey burger over here, but we're going to eat hamburgers.
Right. I know of a family, and it's interesting. So some of this, I'm even thinking about it clinically now, some of it really depends on what the goal is. So if the goal for a child is for them to become more comfortable eating out, more comfortable trying new foods, then you don't want the entire family to switch on behalf of them, because it's kind of feeding that fear and that comfort level.
Yeah.
So maybe if the child is allergic to eggs, the parents will still have the eggs. And some of the advocacy is not the word, but the having, taking the child a little bit out of the comfort zone is they're still going to wash the dishes that had the eggs on them, a little bit where they're not put in a position to be afraid of it, but still almost exposure kind of thing.
Yeah.
And I guess the flip side of that would be if there is a birthday party maybe celebrating that child, then everything there is safe for them. So it's finding a fine line between the full adjustment where the family changes everything for an adult or a child, or I guess it really depends on the goal.
Depends on the goal. Yeah. And when we hit on those love and belonging needs, usually it is about everybody's doing the same thing. Everything is safe.
Right.
Everything is safe. But if the goal is, decreasing anxiety, using exposure, I can see what you mean by okay, well, everybody's going to order whatever they want, and you are going to be safe.
Right, and you can choose, so you have some agency. You can choose not to eat and to wait until you get home if that's what you want to do. You don't want to force feed a child or an adult who doesn't feel comfortable somewhere. But having, if Chick-fil-A fries are what is safe for this child, then the family is going to get what, all the other things that they want to eat. And then you can choose to eat the fries or you can wait till you get home. Like there's choices involved on it too. But
Well, I want to keep us moving to the next level of Maslow's hierarchy of needs, which would be
esteem
needs.
Right. It's interesting that those are I see those as so closely tied to the love and belonging, because the esteem of others and the esteem of self. And what kind of hit could the esteem of a child take if they are sitting at that table and they are the problem, to quote Taylor Swift. And there's work around that. I think it can involve trusting yourself, learning that you're trustworthy to make the decisions that you need to make for yourself. The esteem of others by speaking up for yourself, which can feel counterintuitive. Like people are going to be upset with me if I am rocking the boat on this issue of whether or not we can have Reese's Pieces. But the more that it happens, the more likely it is for people to start respecting for lack of a better term, boundaries, the food boundaries that you have.
I can make some assumptions that having a food allergy is a label. And so in a box that people can be put in. And so people can feel all kinds of ways about that label.
Right.
Whether it is gluten intolerant or dairy intolerant or dairy allergy, I guess, is not... Intolerance and allergies are different.
They're different, but it's just a severity level, so it can still have the same effect.
Yeah. So having an allergy, people can have their own self-judgment or judgments of others.
Right. I feel like, and when I think about self-esteem also, esteem of self, which also plays into others' view of you, this one thing that I've found beneficial is mitigating all the options of something going wrong. And so that gives me more confidence. And it also is, I can have esteem for myself for putting together my bag with my EpiPen, with my children's Benadryl, which I don't have all that with. I have an EpiPen with me now. Children's Benadryl. There's like Unisom sleep melts that they're faster acting than the Benadryl, so you can just put it under your tongue if you were to need it.
So you were talking about how you can be proud of yourself for being prepared.
Right.
For advocating for yourself.
Yeah.
How this can be an element of pride and esteem for yourself.
Right. And it's twofold. One, or maybe threefold. One is knowing like what that emergency kit is, you know, the EpiPen, Benadryl, sleep melts, maybe a safe bar if I need, you know, whatever I might have in that bag. So I know that I'm doing that, which makes me feel safer, which gives me more confidence,
Right.
And allows me to have greater esteem for myself. And then for others, knowing that I've done that work too.
Yeah.
And I think like there's a fine line between letting people know what I do if it's a new restaurant. You know, what my step. Do I look at the menu? Do they look like they're allergen friendly even though they won't know about my allergy? They do. Okay, so that feels okay. I can just ask a few questions. Oh, I don't know if they do. I need to call them. Okay, well, I'm not going to call during, you know, the dinner rush because they're not going to get a good answer from anybody because they're really, like all those different. So not everybody needs to know all of those things.
Yep.
But sometimes some people do need to know because then I'm feeling like, yeah, and I do a lot for myself. I should be proud of myself. And then they have an understanding and go, wow, you really are managing that.
Yeah.
Also, that's one thing that my family does pretty well is they'll say to me, because this is still fairly new, 2018, but 2019 was my diagnosis. But they'll say, you really manage this well, Heather.
Wow.
And sometimes I'm like, okay, yeah, thanks, you know, because it can feel a little bit awkward. But as people who watch others manage anything, food allergies, you know, or what we're talking about, but just that acknowledgement of you're doing a really good job at that.
Yeah, that's something that even if you don't have a food allergy, you can stay and notice.
Right.
And bring up, even if it is a little bit awkward.
Right.
To help build the esteem and belonging.
Right, exactly.
And safety, right? Like
yes,
we're just dropping. It seems like so many of these are connected.
Right.
And so people who love people with food allergies can notice.
Right.
And show people that they notice.
Right.
How much they have to do.
And there was somebody that was in the our therapy meetup group. I cannot think of her name now, but her daughter has a food allergy. And this takes us to the self-actualization, which my application of that is advocating for others, doing something. I have a friend that is a great cook, and I keep telling her, come up with an alpha-gal recipe, like a cookbook, you know. And so that might be her form of self-actualization in regards to food allergy. But the daughter of this person whose name I can't think of created a like home goods, dairy-free, gluten-free baked goods. Yeah. And was selling them to people. And so she got creative and learned how to cook around the things that she could eat to make good substitutions. So I think that's part of self-actualization. I think part of it too is because you mentioned identity and the labels, is that my food allergy is a part of me. It's not all of me. And not my self-advocacy, but my self-actualization is that I am working with individuals who I can personally relate to. That's what I can bring to the field, and hopefully a dissertation that gets published. But that's like you said, they're all connected. So if you're meeting your basic needs, you feel safe. Love and belonging is really, I think, the one that becomes a little trickier because it involves interpersonal, like, depth of relationship.
Right.
But if there's enough solidity there, that feeds into esteem. And that esteem feeds into, like, if I can take care of myself, I can help others take care of themselves too.
Yeah.
So they do kind of like, Maslow knew what he was talking about.
Yeah. It seems like part of that self-actualization is almost, I want to say, like, having fun
Mm-hmm.
or joy.
Yes.
That this food allergy is, this is a part of my life, and I'm still gonna go on vacation.
Mm-hmm.
I'm still going to talk about it.
Right.
And I'm gonna own it. And it's not going to be all of my life.
Right.
And everything that I talk about, everything I think about.
Right. I have 2 friends that I met. So I spoke at this Alpha Gal Symposium on a whim. The person who was putting it together, I just sent her a message on Facebook, I think, and said, hey, have you ever thought about mental health in this? And she was like, hey, do you want to come speak? And I was like, ah.
Wow.
So, and it was not at Virginia Tech, but sponsored by Virginia Tech. So I met these 2 girls, Candace and Debbie, and they have formed a nonprofit called 2 Alpha Gals. And their tagline is finding joy.
Wow.
And they coach people in some really basic, not really basic, I shouldn't say that, in helping newly diagnosed people, like, here are some basic things that are going to make things easier for you. And then they do have a podcast. They do all these different things, but the whole point is finding joy within this food allergy. Recreating, they got together for an Easter dinner, and so they made it Mediterranean. And they're like, well, it makes sense because the Middle East is where Easter happened, and we can make all these safe foods. So it's this whole new event that they've put together. But yeah, 2 Alpha Gals, if anybody wants to go look them up, they're great.
Yeah, that's so great. Well, I'm wondering, one of the values for this podcast is sometimes we just keep people company as they're sitting with 2 people, maybe picking something up, maybe not picking something up. I'm wondering if you can help kind of sum up. If somebody has kind of checked out for most of the podcast and is checking back in, like, oh, what do I need to know?
Right.
Something that you hope that people take from this podcast.
Oh, one is that if you find yourself in a position with a food allergy, just because they are becoming more common doesn't mean that any mental health struggles are should be any easier. And if you are struggling with managing anxiety or depressive symptoms, I wouldn't say depression necessarily, or identity issues, even, like, asking for help, just because you may know someone with a food allergy that's doing fine doesn't mean that that you can't have assistance, professional assistance with that. For people with food allergies, I mean, and I'm thinking through, like, what would I say to a 9-year-old? What would I say to a 16-year-old? What would I say to...
So individual.
Right. But, I mean, we are a community in and of ourselves. It's really kind of cool to see some of the people on these Facebook groups. So, I mean, any kind of Facebook group, some people are mean, some people are nice, but the supportive network that you can find there. And if there's not anyone in your real life, I mean, there are lots of online support groups and stuff like that you could reach out to. Ask your allergist if he knows of anybody, like, get connected with people that understand you. If you do not have a food allergy, be an ally, be an advocate. And whether that's, let me order for you today. Thank you.
Let me call them and ask.
Yeah. Tell me the questions you need me to ask, then let me call them for you. Or if someone says, I'm feeling uneasy about this restaurant because I didn't do my full vetting job. Don't be like, ugh, okay.
Right.
Because that happens sometimes too. And whether it's, a lot of times if you are the one who's making the waves, you're I am overly sensitive to that kind of, I'm like, I may be misinterpreting it anyway, but, so yeah, I think that's important. I think that, listening to yourself, listening to your body, learning if you have a food allergy, anxiety and a reaction are very similar physiologically. So know the exact thing. Like I know that if most times I haven't had a reaction in a really long time, but most times if I am going to have a traditional reaction, I'll start getting hives right here. And so I know that's where it starts for me. And, if it starts down here, then I'd be a bit like, oh, let me pay attention to that. But know what your body does. And that way you can distinguish between whether it is a reaction or anxiety. I got a vaccination and I was like, oh, is my throat getting tight? Can I breathe? Am I there? And I'm like, no, you're just nervous because you just got this vaccination. Another thing is for clinicians that are listening to be aware of ways to make their offices even more friendly. So if you know that you have someone coming in with a food allergy, one thing I had to do, which I had not been aware of at the time, was remove any fake smells that were in the office, like air fresheners. And I don't know of a ton of clinicians that would have snacks or, stuff, maybe some do with children or whatever.
I do. Yeah.
Yeah. And being aware of, the options that you have for snacks for kids. And even, I guess, drinks and stuff in the office for adults. And if, things need to be wiped down, if you have had a child that has eaten peanut butter and crackers and then played with something, wipe that off. And all of that's important. I think it's more important if you know that somebody has some sort of food allergy. And even asking that question, just, because that could, when you're looking at things that can contribute to, or vulnerability factors in someone's life, if that's something they're managing on top of, or if they're managing it for a child, or just adds another layer to who they are.
Yeah. I mean, I think that's, after hearing you speak, I started looking out for and asking about food allergies. Just to take into consideration how food allergies do affect the presentation in our office. When they say they have anxiety, I'm like, tell me about this, and this. And one of them being allergies. So, there you go.
It's just, there's lots of
being
different
aware
ways to incorporate. It's the more you know.
The more you know. Yeah. Well, that was exactly what I was going to say about, I think what I'm walking away with is people who do not have food allergies can be advocates and allies. And it's really important for people to have allies.
Absolutely.
Yeah.
And even the parents, like if you are a parent friend of someone whose kid has a food allergy, be the safe place they can send their kid.
Exactly. Well, I really appreciate you being on the podcast.
Woohoo!
Woohoo!
My first podcast.
Your first podcast. And for our listeners, I was like, which camera am I looking at? And for our listeners, you can find us on TikTok. You can find us on Instagram. You can find us on YouTube. You can find us at 7110 Crossroads Boulevard. And where can the people find you?
Let's say Heather Hargis, Hargis, LMFT.com. It's also, I'm also on Facebook and Instagram. I'm just not always super active.
Active there.
Yeah. Heather Hargis, LMFT.com.
Amazing. Well, I hope you got comfortable because we are off the clock.